really sick because people would have, people are using. Okay.
That's all. Okay, great. That's all great information. Thank you very much. Are you guys ready to answer some questions for us?
Yes.
Quite a few. The first one comes from Emily, from Emily's Entourage. Hello, Emily. We're glad to have you with us tonight. Hope you're doing well. Emily asked, what is your recommendation for receiving mail and packages and bringing them into the home?
That's a good question. Tough, to be 100% certain about it. One thing to say is that the virus can, survive on surfaces for up to, 3 days, and some places in the cabins of, a cruise ship, they found it even longer. The other thing, however, behind it is that if it travels and it moves, it's less likely to survive there. You want to be 100% safe, disinfect the package, use, some wipes or something like that to make sure, that it doesn't have that. Or after you open and you throw away the outside, make sure you wash your hands very well, because it's what Dan said, just before. It's impossible to avoid touching your face. But what you have to do is, if you touch a surface that you don't know, where it has been, make sure you wash your hands, and that should cover the things. Dan, anything to add to that?
Yeah, and I think and if you're trying to be careful, keeping in mind that it's not just the outside of the package, but what's inside the package, with the person who is putting it in a box at Amazon or wherever else. If you're going to be really careful, it's going step by step with the process. Or if it's something that you don't really need to use that package, you could just leave that package somewhere where it's untouched, because the virus does. There was a study showing that on cardboard surfaces or plastic surfaces, the virus can last for about 4 days. But if it's one of those things where it's like, oh, this is a package that I need, but I don't need it in the next week, well, then let it sit by itself for a week, and the virus will die off on it in the meantime.
Yeah, that's what I either send my wife out to get the mail, put her at risk, or we'll leave the mail out for like 24 hours, and then we'll bring it in, and Chris wipes it all down and disinfects it before we open it. She'll take it into a different room. But yeah, we're just being extra careful by doing that, and we'll wear gloves when we receive the mail as well. So that's what I'm doing. Next question. Sorry, I got kicked out for a little while, so I don't know if you guys touched upon this. So if you did, just let me know. Can you please touch more on acetaminophen versus ibuprofen? Very mixed information out there. Thanks.
Yeah, this is something we didn't talk about. Do you want to take this, Dennis?
Sure. Okay. So there is, a report from France. The Minister of France a few, weeks ago came about and said, do not use, ibuprofen, naproxen, all the NSAIDs, non-steroidal drugs. Because there were some reports that maybe the way that they work might lead to worse, outcomes in people that have this type of pneumonia that you develop from the virus. When you talk to most of the experts and you look hard at the data, there's no good evidence to support that those drugs are really, worse than other things. There is some theoretical reasons where it might be. So that's why we tell the patients, try acetaminophen first anyway, because it has the same effect on fever and relieving symptoms. So you should go, for that one, first. But as far as I say, do I really feel that you're doing harm if you have to take ibuprofen? I don't think so. It's just, one of those theoretical things that if you have two choices, you go with the choice that you think might be, a little bit on the safer side. In addition to that, medications like ibuprofen, they might also increase your risk of bleeding and issues like that. So it's easier, to avoid them, especially if you're somebody that might have, some occasional, coughing up blood, episodes. The only caveat to this is that people that have severe liver disease cannot take a lot of acetaminophen. They can take maybe up to 2 grams a day. But 2 grams a day is not a little. It's enough, to probably help you, quite a bit. Dan, anything to add?
Yeah, I think it's, because when I was talking about it, I talked about how some people made some hasty statements about how effective certain treatments could be without adequate information. And I think that Minister of France made the blanket statement against things like ibuprofen it was too strong a statement. As Dennis said, there's some theoretical reasons why maybe it could be problematic, but we really don't know that for sure. Now, with those theoretical reasons, though, it does make sense to go with something that seems safer if it works. But if Tylenol isn't controlling the fever, then you just may say, okay, well, it's time to use Plan B.
Got it. Okay. Madeline asks, is azithromycin going to become short in supply?
It's impossible to know as an answer. However, if people use it, more, it might become short in supply, but it's such a commonly prescribed antibiotic that I hope we're going to have enough.
Okay.
Done?
Yeah, I don't have anything to add to that. I agree.
Okay. Anonymous. My spouse has CF, had a transplant, and has had a cold for 3 weeks. He had a regular viral test and tested positive for coronavirus, not COVID-19. Should he be tested?
Yeah, I think it's hard for, especially when we're working off just brief statements in a question and answer session. It's really a challenging thing. I think this is something that warrants a medical appointment through telemedicine, or I don't know if the husband is one of our patients, in which case we would certainly be happy to do a clinical visit where we can talk through all the details. Because I think it's hard when you just have a quick synopsis of the situation to really get accurate clinical information. So I would say this is not the setting, even though I practice medicine in real life. In the midst of this is not the right setting for me to practice medicine and give specific advice for an individual.
Sure.
But I think this is definitely a conversation that should be had with the CF team or the transplant team.
So the only comment that I'm going to make here, as a transplant, physician, people with transplant sometimes can carry coronavirus and common cold symptoms for weeks. So it's not uncommon to see something lasting for a long time if you have a common coronavirus. It doesn't mean that because it's lasting longer, it's definitely COVID or something bad, as long as that person's okay. But I fully agree with Dan about that.
Okay. Molly asks, have you seen or heard any CF patients that have COVID-19? If so, do you know how they're doing?
I have not had, anything, yet that I know of. Dan might have more up-to-date information. There are a few cases that were, in general, reported to us from Italy, where this were, shared through the CF listserv, the physician listserv. And there didn't seem to be a lot of severe disease. There was a handful of patients that most of them seem to have done okay. And at least with all the stuff that's going on in Italy, you would expect that you hear that the CF population is having a lot of trouble. It didn't seem that there was a lot of reports that are saying things are really, bad from our perspective. Anything from your side, Dan?
Yeah, I mean, at least at our center, there have been a few people who we thought might have COVID, and we tested them. So far, everyone we've tested has either been negative or, since the test can take several days to come back, it may still be pending. But yeah, so we don't have firsthand experience, but I agree that what we've heard secondhand is actually somewhat reassuring, although it's small numbers and it's early to know for sure. I mean, one part that I'm hoping for, but I know hope is not a strategy, is just the idea that I'm hoping age outweighs underlying medical conditions in this case, and the fact that most of our patients are on the younger side will help protect our population. That's speculation, and certainly no reason to be cavalier with taking precautions. But I'm hoping that this ends up being something that spares the CF community. And the other thought that keeps occurring to me, and I know not everybody with CF is able to take Trikafta or gets the same benefit as everybody else, but if there's any silver lining to this, it's that it happened now instead of a year ago, because we have a lot of patients who have gained a huge benefit from starting Trikafta that I think, gets closer to undoing some of the issues going on with people's lungs, so that, with the whole idea of medical comorbidities that put people at risk for severe infections, can be helpful. And anecdotally, there was one other thing. I was talking to a patient today who was saying they were on some email exchange with somebody in England who had a lung function of 25% predicted, got COVID-19 and is recovering really well. So that's a single case that I've heard secondhand about. But
Yes.
Great. To expand on that, Carolyn asks, I'm wondering how you are handling patients that are due for liver function tests, liver function tests caused on Trikafta, but are afraid to go out.
It depends on the situation. If it's somebody that has had already a set of liver function tests after Trikafta, they have had no major liver problems and they're okay, I would say defer it. Why get out and risk exposure? If it's somebody who really has just started the medication or they have prior problems with the liver tests, I would say that it's appropriate to find a time and a way to go ahead and do your liver tests. Because then the harm, you just have to weigh the risk. If it looks like you're worried about liver toxicity, then you have to mitigate that and make sure that that your liver is not in trouble. But for most patients, and most patients that have taken Trikafta have had no major problems, what we tell them is, if you're going to do it, this month, don't do it this month, do it next month, do it in a month and a half. It doesn't matter from my perspective.
Okay.
yeah, and the other thing I would add is if you're somebody who really needs to get those tests done, is call the lab ahead of time, find out what their infection control processes are, what they're doing to protect patients who are getting blood draws, because there are going to be some people who need blood draws in this situation. So you feel free to call ahead and make sure, don't just show up and hope that they're going to do the right thing. Do your due diligence to find out that lab is going to protect you when you're going in.
Okay. What do you recommend if a family member or loved one living together is diagnosed with COVID-19?
I'll give you this one, Dan.
Yeah, I think this is a challenge because I think some of it's, do you have a living space where you can quarantine and separate from each other, which is really that ideal thing that you would want to do. I mean, this is a reality that I potentially will be facing soon with the idea that we know the hospital is filling up quickly and they're going to be pulling all of us in to cover in the hospital as needed. And so even at that point where I figure I'm going to be exposed to a lot of patients with COVID-19, making plans for, okay, how do I come home but still isolate myself from my family and try to protect them. So some people just don't have a living space that makes this possible. But if it can be that separate living space, separate bathrooms, not sharing anything, leave meals at the door, using Clorox wipes, wiping down everything that you can. It's a challenging situation, but I think it's worth trying to quarantine an individual even within their own family as much as possible.
If you have an option of being safe somewhere else without risking, major exposures, that's also, an option for some people. But then you have to balance that. You have your support system there. Are you exposing other people, that might be vulnerable? And do you expose yourself to other people? But what Dan said, that's all I'm going to say. That's, very well.
Shannon asks, do you know if COVID-19 dies in the freezer? I'm assuming the germs like ice. I don't know if that's...
I do not know that, but I would doubt it. I think, most, bugs can find, ways of, basically being preserved there. They might not grow very fast, but I don't think that that's the case. Dan, do you know anything about this?
Yeah, I don't know for sure, but I know there are, a lot of situations where labs that are studying things, they freeze things to preserve them. So I would not be confident that the freezer would kill things off. But I think there's a certain degree of heat at which point, like something that's been that you cooked yourself and you just took out of the oven. I think that anything that you're taking out of the oven is safe. Now, granted, if it was cooked at a restaurant, who knows what the packaging has on the outside of it. But yeah, so I'm more confident that heat would kill the virus than freezing.
Yeah, so I have a question. If we get takeout, which we probably shouldn't be doing, if we throw that in the microwave, do you think, would that help?
Probably. We don't have, nobody's formally tested that, but I think there's a good reason to think that would be helpful, but there's no guarantee that it is.
Got it. how long do you think us CFers are going to have to isolate? I've heard as long as 12 to 18 months. That's terrifying. That is terrifying.
There is a paradox to this. Based on the slide that Dan showed, before, the better job we do with distancing, the longer this will take, unfortunately, which is weird. Okay, and unless we manage to do such a good job that it dies out, which so far we haven't been able. The best thing that we can do is slow, the spread. So I doubt it's going to be 12 to 18 months, but we're here for the long haul in many perspectives. And in many perspectives, that's what we want. If we let it, go rampant, a lot of people are going to get sick and it's going to go away sooner. But we're going to have a lot of casualties, not just in CF community, but among everybody. So that's what we're trying to do. We do not know for sure. There's a lot of unknowns here. But 12 to 18 months, we would like to think that by that time, we'll have either a high number of people that have already recovered, and therefore they're immune, so we create what they call herd immunity, which is why, we don't see a lot of measles, anymore, unless, you have pockets of people that are not vaccinated. Or we're going to have, some effective medications, or we're going to have a vaccine by that time. So we're going to be able, to avoid all those things.
Yeah, and I think that 12 to 18 month number comes from estimates of how long it would take to develop an effective vaccine. But I think there are other things to keep in mind. The idea that there are research trials going on for medications to treat the virus. And if it turns out to be something where a medication is incredibly successful and all of a sudden drops the danger of this infection dramatically, well, then people will, then the whole idea is then the social distancing becomes more harmful than helpful because it breaks the economy. Whereas if you had a good treatment and you said, hey, people are going to get the infection, but we can treat them if they get sick enough and they're going to be okay, that would completely change the picture. So part of it is trying to slow things down in these early phases while we're trying to figure out what works. But then if we can find something that really works, that really changes what this infection means for people in general. And then we could sort of loosen up and say, okay, it's okay if people get exposed to this and get the infection because we can get them through it.
Okay, great. We have about 5 minutes left, so I'll ask one or two more questions. If I feel like I need to be admitted to the hospital, what is the best course of action? Contact the CF care team, go to the emergency room, or do you do a direct admit?
Call the CF team. Go ahead, Dan. Sorry.
Yeah, I think calling the CF team, if it depending on, I feel like our team is very quick to respond. Depending on, I don't know that I can speak for all centers that all centers respond to calls as quickly as we try to. If you can get a quick response, then call your CF team. But the other thing to keep in mind is it depends on how dire things are getting, because we definitely know that when things turn bad with COVID-19, it can go quick. So if it's a matter of, hey, I have a fever and a cough, but I'm breathing okay, then definitely call your CF team. If it's my breathing is getting worse and it's getting worse quickly, then you might not have the luxury of time, and going to the ER might be the move you need to make. So it's going to be at a bit of a judgment call based on those circumstances.
If all you need is testing, the best thing to do is not to go to the emergency room, because there are ways that you can be tested, safer. If you have it, you won't expose other people and you won't backlog, the ER. But also, if you don't have it, you don't risk yourself being exposed to other people that might have it. So if you're, feeling relative, and that's why, sometimes getting in touch with your healthcare provider will help you, kind of triage this. But if you're in dire straits, of course, you have to go to the emergency room, because that's where you need care at that point.
Okay, great. What's the risk of encountering the virus? Yeah, there has been discussion about the virus now being airborne. Someone sneezed while I was out walking.
Mm-hmm.
I guess they're asking what the chance is. That's a tough one.
And I think that's partly hard too, because now we've got this infection going and we're hitting allergy season. So there are going to be people sneezing out there from allergies. And I mean, heck, every day if I have like a little sniffle, I have a question in the back of my mind, because I certainly don't want to be spreading an infection to other people. Mm-hmm. So I think we know that this infection mainly spreads through droplets, and usually within a 6 feet radius is the range that droplets spread. It can go airborne in certain circumstances, and the things that tend to make it go airborne are most often medical procedures. And actually one thing that's useful to know within the CF community is nebulizers can make an aerosol of the virus, so it can spread it throughout a room. So we've actually been telling some people, especially if you think you might have COVID, if you're going to be nebulizing, try to do it in a room where you're going to be by yourself and nobody else is going into that room to try to decrease spread. And then a lot of medical procedures that involve going, you know, whether it's putting a tube into somebody's throat to connect them to a ventilator, or doing a bronchoscopy, procedures like that, or even oxygen when it's at really high flow levels can cause the virus to aerosolize. So it sort of depends on the circumstances, whether the concern is more in the 6-foot radius or it's further out. But that is part of where, when you're out and about walking, I'm seeing people do this more and more, that it's giving each other as wide a berth as you can. And if you see somebody sneeze 20 feet away, feel free to turn around and walk the other direction. Like this is not a time for social graces. This is a time to be safe.
Great. One last question from me. Can we see the shirts you guys are wearing?
Mm-hmm.
Can you show us your shirts? Nice.
Yep, there you go.
Sorry, a little self-promotion there.
Yeah.
All right, thank you very much. It's 8:30. I want to thank everybody for joining us. We had a really good attendance tonight. We're in the 100 range, over close to 200 people. So I really appreciate everybody attending. You guys have answered all of our questions. It was great information. We can try and I'm sorry we couldn't get to everybody's questions, but we will keep these, and maybe Dan and Dr. Dorgan and Dr. Hadjiliadis can take a look at them, and we can weed through some of the ones that we have not answered. And this will also, a recording of this will be up on our website in the next few days. So I want a sincere thank you to both of you for taking time out of your busy schedule to answer our questions. I know in this very stressful time, you answering these questions, at least for me, comforting. Again, I'd also like to thank our sponsors who helped make tonight possible. We appreciate all of you, Vivus, Alliance RX, Gilead, and Mylan. We appreciate you for helping make this webinar possible, and needs appreciate it, and for your viewing. Maybe we can do this again in a few weeks as an update to this. As like Dan said, everything's evolving day by day, and there's going to be new information. There's probably going to be new information tomorrow. But please be sure to visit our website, take a breather from cf.org, where you can find out more about our foundation and our mission, and ways that you can help support those with CF. Thank you, everybody. Thank you for being here tonight. We appreciate it.
Yeah, thanks for setting this up, Matt.
Thank you.
Yep, thank you.
Be safe, everybody.
Yes, be safe. Thank you. Be healthy. Let's see. Perrin, I think, Perrin, are we still live?